Hey guys, and welcome to How to Gastro. So in today's video, we'll be exploring what is a potassium blood test. So let's get started. So before we get into the specifics of the potassium blood test itself, let's talk a little bit about what you can expect when your doctor orders this blood test for you. So a potassium blood test is a simple test that can be done at your closest laboratory or hospital. No special preparation is needed for a potassium blood test, which means you don't have to fast, so you can eat and drink as usual before the test. During the test, a blood sample will be collected from you, which means a needle will be inserted into a vein, usually in your arm, to draw out some blood into a gold top or SST blood tube. This blood tube is then sent off to the laboratory where it is analyzed and resulted. So what is potassium? Potassium is an essential electrolyte that plays a critical role in maintaining various physiological functions in the human body. It helps to conduct electrical signals, regulate fluid balance, and supports proper muscle and nerve function. Potassium is especially important for number 1, proper nerve function. So potassium helps in maintaining electrical impulses in nerves, which is essential for muscle contractions and reflexes. Number 2, muscle contractions. So potassium also aids in smooth and coordinated muscle movements, including the heart muscle. It helps to maintain a regular heartbeat and supports normal cardiac function. Number 3, it's important for fluid balance. So potassium also helps to regulate the balance of fluids inside and outside of cells by working alongside sodium, which is another key electrolyte in maintaining proper fluid balance. And finally, number 4, potassium is also important for blood pressure regulation. So potassium helps to counteract the effects of sodium, contributing to lowering the blood pressure and reducing the individual's risk of developing hypertension. So now that we know what potassium is, let's take a closer look at what the potassium blood test is all about. So what is a potassium blood test? A potassium blood test is a test that measures the amount of potassium in the blood. So as we saw in the previous slide, potassium is an essential electrolyte that helps to maintain proper cell function in the body, particularly in the nerves, muscles, and the heart. This test is used to assess whether the potassium levels are within the normal range in your body and to detect any imbalances that could affect bodily functions. So it is also commonly performed as part of the Urea and Electrolytes panel, or the UNE blood test, which includes other important tests like sodium, chloride, bicarbonate, and the blood urea levels. So I've just recently done a video on the UNE blood test, so I will put a link for it in the description below, so you can perhaps watch it in conjunction with this video to get a better understanding of the potassium blood test. So moving along, let's discuss the normal ranges of potassium in the blood. So the normal range for potassium in the blood is typically between 3.6 to 5.2 millimoles per liter. So that normal range again, 3.6 to 5.2 millimoles per liter. We can then have abnormally low potassium values, and this means that the potassium value fell below 3.6 millimoles per liter, and this is a condition known as hypokalemia. We can then have high potassium levels in the blood, and this means we have a potassium level that fell above 5.2 millimoles per liter, and this is a process known as hyperkalemia. So now that we know what the normal ranges look like and what the abnormal ranges look like, let's take a closer look at what causes abnormal potassium levels in the body. So abnormally high potassium levels is a process known as hyperkalemia, and occurs when the potassium concentration in the blood exceeds the upper limit of the normal range, which is typically above 5.2 millimoles per liter. This condition can be potentially serious, especially when the potassium levels are significantly elevated. So there are 7 main causes of hyperkalemia, and they include number 1, kidney disease. So since the kidneys regulate potassium levels, any kidney dysfunction can lead to an accumulation of potassium in the blood, causing hyperkalemia. Number 2 is the use of certain medications. So some drugs like potassium-sparing diuretics, ACE inhibitors, and ARBs, or angiotensin receptor blockers, can also raise the potassium levels in the blood. At number 3, we have excessive potassium intake. So although this is rare, consuming too much potassium through supplements or potassium-rich foods, which includes bananas, avocados, and spinach, can contribute to hyperkalemia, especially in individuals with kidney disease or kidney issues. At number 4, we have dehydration. So severe dehydration can reduce the body's ability to excrete potassium effectively, leading to hyperkalemia. At number 5, we have adrenal gland disorders. So conditions like Addison's disease, where the adrenal glands don't produce enough hormones, can affect potassium regulation too, raising their blood levels. Number 6 is tissue damage. So severe trauma, burns, or conditions like rhabdomyolysis, which is a disease that causes the muscles to break down, can release large amounts of potassium into the bloodstream, leading to hyperkalemia. And finally, at number 7, we have uncontrolled diabetes. So poorly managed diabetes can lead to hyperkalemia due to the shifts in potassium between the cells and the bloodstream. So if we take a closer look at this little bubble on the left bottom corner of my screen, you'll see I've included some symptoms of hyperkalemia. So these patients usually present with muscle weakness or paralysis, fatigue, numbness and tingling, nausea and vomiting, and irregular heartbeats, which are known as arrhythmias, which can lead to serious heart issues like cardiac arrest if they are left untreated. So moving along, let's discuss abnormally low levels of potassium. So abnormally low potassium levels is known as hypokalemia and occurs when the potassium concentration in the blood drops below 3.6 millimoles per liter. This can affect normal cell function, particularly in the muscles and the heart, and can lead to a range of health issues if left untreated. So there are actually 10 main causes that can contribute to the development of hypokalemia, and they include number 1, diarrhea or vomiting. So both diarrhea and vomiting can lead to significant potassium loss through the bodily fluids. Number 2 is diuretics. So medications that increase the urine output, especially loop diuretics or thiazide diuretics, can cause potassium depletion in the blood. Number 3 is excessive sweating. So prolonged sweating can lead to potassium loss, especially in individuals who engage in intense physical activity without proper electrolyte replenishment. Number 4 is a poor diet. So inadequate intake of potassium-rich foods such as spinach, avocados, and bananas, though less common, can contribute to hypokalemia, especially when combined with other factors such as illness or the use of certain medications. At number 5, we have chronic kidney disease. So in certain cases, the kidneys may lose potassium due to its inability to reabsorb it properly, leading to hypokalemia. At number 6, we have hyperaldosteronism. So this is a condition where the adrenal glands produce too much aldosterone, which can lead to potassium loss through the urine. At number 7, we have Cushing's syndrome. So this condition involves excess cortisol, which can also lead to hypokalemia. At number 8, we have the use of certain laxatives. So chronic use or the abuse of laxatives can result in potassium depletion and hypokalemia. Number 9 is magnesium deficiency. So low magnesium levels can affect the potassium balance and is often seen in conjunction with the development of hypokalemia. And finally, at number 10, we have the shifts in potassium levels. So certain conditions like insulin use in individuals with diabetes or alkalosis, which is an abnormal increase in the blood pH, can cause potassium to shift from the bloodstream into the cells, lowering its concentration in the blood, meaning it will show up as a hypokalemia on a blood report. So the symptoms of hypokalemia include muscle weakness, cramping or twitching, fatigue or lethargy, constipation, irregular heartbeats, which are known as arrhythmias, tingling or numbness, and in severe cases, paralysis or dangerous heart rhythms, such as a ventricular fibrillation, which can occur. And so the take-home message. So as we have just seen, the potassium blood test is crucial for ensuring proper heart function, monitoring kidney health, managing medications that influence potassium, detecting electrolyte imbalances, supporting muscle and nerve function, and diagnosing hormonal and metabolic conditions. By identifying abnormal potassium levels early, this test helps to prevent serious complications like heart problems, muscle dysfunction, and even life-threatening conditions such as a cardiac arrest. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found the presentation very interesting and informative. Please make sure to like, comment, subscribe, and share this video with anyone you think may find it useful. So if you want to encourage me to do even more, or to say thanks for all the free information you've received on my channel today, you can say thank you by buying me a coffee. So the link to buy me a coffee can be found in the description box below. Take care and have an awesome day further. Bye for now.